Welcome to Chamber Exchange, a TV show. My name is Tim Murray, President and CEO of the Worcester Regional Chamber of Commerce. And Chamber Exchange, a TV show, is brought to you by our sponsors, Bank Hometown and St. Vincent Hospital. And it's an opportunity for us to bring on Chamber member businesses and organizations or other individuals in the community who are playing a role in economic development and workforce development here in Central Massachusetts. So very happy to have with us here on our first segment, Lynne Alexandrowicz, who is a certified dementia practitioner and business development manager, and Martine Beaumont, who is the CEO of Accessible Home Healthcare, which is a private pay medical model home care agency. Lynne, Martine, welcome.
Thank you for having us.
Well, you know, there's probably no industry that is more rapidly changing with more demands on it than our healthcare space. And so certainly I think our viewers would be familiar with kind of home health care, but it sounds like you've got a bit of a unique model. So maybe Lynne, as the CEO, will let you, Martine will let you start off as the CEO.
Yes, thank you. So yes, we are Accessible Home Care of Central Massachusetts, and we've opened our door like 8 years ago. Lynne's been with us from day one, and I am the CEO, as I said, but also a co-owner. I have two other partners, and one of the other partners, Ruth Langley, is the clinical director of Accessible Home Care. So yes, home care is very much needed, and both Ruth and I and Lynne took care of our mother in our home. My mother's 94 years old. She still lives with me, kicking it. Often says she's gonna outlive me, and I believe is the quality one-on-one care that she gets at home. So I previously was at Blue Cross as an executive there, and I just felt the need to help elderlies, my partner and I, and because we know there is a shortage of care for people in their home. And one of the things that we know is that people thrive better in the privacy and the comfort of their own home. So what sets us apart is from day one, we had a very strict rule where we did not cancel on clients, right? So if a aide called out and nobody was available, either myself or my partner were there. There's been time, there were snowstorms, you know, people called out and we were there because people need liability. They need somebody that is reliable because their parents need the care. We are private duty, we are not insurance, and Lynne will get into the difference between us and some of our competitors. But what sets us out apart, and you can look us up, we are one of the top Google My Business for private duty in Central Massachusetts, I believe is the one-on-one reliable care that we provide for my client. From the time you put the call in till you discharge, you get a one-on-one concierge service. Our service is not global, it is uniquely set up our assessment one-on-one care plan where the nurse goes to the patient house and talk to the family, the client, find exactly what they need, and we put a care team in place to execute the services that they require. So that's what really made us successful is the fact that we are reliable and we provide quality services.
Well, thank you, Martine, on that. And Lynne, you're going to talk a little about the pay model, a
Yeah,
little bit
so
different than insurance.
we're a medical model, so there are about 400 private home care agencies in Massachusetts alone, from the Berkshires all the way to the Cape. And we're a medical model, which means that we have RNs on staff with us. So RNs can go in and we work with assisted livings, we work with nursing homes, hospitals, hospice companies, and RNs can go in and they can do injections, they can do IVs, they can do hospice or medications, they do wound care. Excuse me, I have a little bit of a head cold here. We have also certified nursing assistants as well as certified home health care. What sets us apart is because we are a medical model and co-owned, as Martine said, with Ruth Langley, who is an RN, BSN, and is our clinical director also. So that sets us apart of we have that clinical aspect. So we go in with the nurse, we do an assessment, we put together a care plan, and then that care plan is followed by the aide. And that changes when the diagnosis changes also, either increases or decreases. So the assessment will change along with that. What sets us apart, I think, also is that there are so many people that are getting into this industry because I use the story. I met someone one day and I said, what made you get into this industry? Were you a caretaker? You know, do you have a background in healthcare? And they said, it was less money to buy a home care agency excuse me, than it was to buy a Dunkin' Donuts franchise, which is pretty scary.
Yeah, yeah.
So we come with backgrounds of all in healthcare for years. I mean, combined, I've got 40 years in this industry. Ruth has 40 years. You've got, another 20,
plus.
yeah, 35. So we have quite a few years put together. So we brought in a great team of staff. We have what sets us apart also is that we do live-in cases, which means we can have an aide live at that person's home, be there 24/7. They really become part of the family, and that can go from the Berkshires all the way to the Cape. We can also do what they call 24/7, which is 2 shifts of 12 hours. So there's 2 different people going in, and so there's someone there around the clock, and that is focused on the Central Mass marketplace. And then we can also do a minimum of 4 hours. And that's around the Central Mass marketplace as far as the surrounding towns with Worcester and the surrounding towns also. We can do sometimes a minimum of less time, but we have to have aid to be able to do a minimum of 2 hours. So we work closely with our referral sources are the hospitals. As you said, St. V's is one of the sponsors here, so they refer a lot to us. We work a lot with the assisted livings, the nursing homes in the area, and the hospice companies. And we're one of very few home care agencies that can do the hospice medication. So our nurse to nurse, from the hospice nurse to our nurse, as well as our aides have been trained in doing the medication for anyone on hospice.
So you had mentioned, the home piece, but also in addition, in assisted living settings, hospitals even, that you can augment some of the care with your services.
Absolutely. We work with a lot of the assisted livings in the community. And again, somebody will move in and maybe they're in the memory unit until they get adjusted and acclimated. They might need a one-on-one, so we can come in and help. If someone is on hospice and that family member is living at home, and the family's helping out, taking care, as well as the hospice organization is going in. Sometimes, a lot of times, the hours that we're doing is like 11 p to 7 a.m.
So they can get some sleep.
Right, so the family can sleep and they know that their loved one's safe, so.
And you had, before we started, Lynn, I had asked you about CDP, and you said that's one of the credentials
acronyms.
you've earned, acronym, and one of the credentials you've earned is Certified Dementia Practitioner.
Right.
So
it's a national certification that we all have. So, and we do a lot of training with our staff on that because, as you know, everybody that you've either spoken to or whatever, either a family member has been diagnosed with dementia or Alzheimer's. So it's kind of the #1 disease in this area as people age in place. So we are certified, so we know how to really work with the patient as well as the patient's families, which makes a big difference. So
that is correct. And a lot of our clients are also over 18, so sometimes people need short care services, after they had a surgery, and then after rehab, they need us for like 6-5 weeks. So we also there for that. But one of the services that Lynn mentioned, live-in home care, is extremely important because a lot of people do not want to go to a nursing home. They do not want to go to assisted living. They want to stay home. So we provide that service throughout the entire state of Massachusetts. So, and that's what helped me with my mom. So I can still run a business. I have somebody there living in with my mom 24 hours a day, but I can still have a life and do the things that I need to and know she's in the best care.
Right. And so, again, private pay, different than
a certified. So there's 2 different types of home care in the industry. So private pay, which we are, which means we don't accept insurance. We do accept long-term care insurance, and we also, if someone is a veteran, we have an aid and attendance program if they meet the qualifications. But insurance does not pay for our care. The other type is a Medicare certified home care agency, which means that they work with Medicare and Medicaid, and there's strict rules that has to be followed. So they have to see a patient, within 24 hours of being discharged from a nursing home or a hospital. When that patient is receiving care at home from the certified agency, they cannot go out. They can't go to the grocery store. They can't go anywhere besides a physician's follow-up visit. So it makes a big difference. And we work closely with a lot of the certified agencies. So that is run by insurance. So they may say, we're going to give them 2 weeks of physical therapy, occupational therapy, and nursing. And then once the insurance company says, okay, we've reached that max, but they still need additional care,
They call us.
then they call us and we come in and help out.
So we just got less than a minute left. So
Okay.
if people, I see a flyer
Sure.
there, so I'm sure
Sure,
there's a
our
website.
brochure, our new brochure.
Yeah, so if people want to
Yeah,
learn more,
we're
have a
located in
conversation.
Auburn. Our offices are in Auburn on Southbridge Street. Best way to reach us is our office number is 508-859-1644. And our website is www.accessiblecentralmass.com.
Great. Martine, Lynn, thank you for
Thank
being
you
with
so
us.
much for having us today.
Really interesting
Thank you so much.
conversation and learn
Okay.
about kind of a unique service that you
Great.
provide.
Thank you so much.
These days, you've got your hands full in life. That's why we help you bank simply and securely with tools like Face ID and Touch ID. It's why we make it easy to make purchases on the go and get cash back while you're at it. Why we help you quickly deposit checks wherever you are. And it's why we lend a hand with sending and receiving money right from your phone. So even when you're on the move, you can manage your finances. Bank Hometown. Unlock your potential.